I think in general, all substance use is in the past like 10, 20 years is kind of going down, but there is a rise in cannabis use and risk of cannabis use disorder. And what's underlying this risk is that now that it's been increasingly decriminalized and legalized, you have more and more diversity of products and different ways of like using it, and also way stronger marijuana than like in previous years. The and if you have a more potent drug, the risk for addiction is greater. And so, first of all, there's more availability. I know you can't walk down the street in New York without like smelling weed. There's like one or two um, sort of smoke shops or like recreational dispensaries almost on every block. And so it's always around. And then if you have greater access to it, and not just that, but the ones that you have like wild amounts of like THC. They're like, 500 milligram candies. Um, and so there's a greater potency, and then people think that, oh, this is not like that big of a deal. Um, and that is also kind of a little bit misguided. Uh, those with ADHD are at greater risk than those without ADHD. So I started saying that young adults are at risk for cannabis use disorder and youth with ADHD, and I want to start earlier, like younger, so teenagers. They're at really great risk. One, because people with ADHD tend to start or experiment with drugs earlier than neurotypical children and teens. And then once they do try a drug or something, they're more likely to progress to regular use. So they start using more regularly faster than their peers. Not only that, but once they do use, even if they use like drink the same amount, or if they use the same amount or have similar patterns, they tend to get into more trouble or have worse consequences following use. And these consequences, are the basically underlie a problematic use or a use disorder. There's ADHD symptoms of sort of impulsivity, sleep disturbances, sensation seeking. Like all of these things could be even like motives for substance use. And so some of the more heartbreaking things that I've noticed or that I've read are studies that talk about like what are the motivations for those with ADHD to use substances or cannabis. For some, boredom, sensation seeking, but also to try to feel normal, to try to fit in, to quiet the thoughts, to calm the hyperactivity. Some claim it helps them focus or to fall asleep. And so sometimes I think the underlying motives for why people use are really important to not discount, but it is a little bit misguided in terms of reaching for cannabis or other drugs of abuse before finding better ways to kind of treat those things. And I do want to say that it's not lost on me that it can be very prohibitive to find a psychologist or psychiatrist that can help with like treatment, and compared to how easy you can access these drugs on the street and how quickly you can do that. So it's sort of a losing battle if we don't try to identify this risk and do something about it earlier. The other thing I wanted to say, why I think it's really important to try to talk about this or get a handle of it before the teens kind of go to college or reach that, the higher risk age of 18 to 25, is that once you turn 18, a lot of these experimental things are kind of, mistakes or problems or consequences from youth become crimes, right? I think when you're under 18, there is a level of like protection while you kind of figure some of these things out. And so I think sort of the earlier, the better, that you can try to engage your teens or youth in treatment, talk to them about substance use and some of these risks. And so what are some of these risks? What are the adverse effects of cannabis use? So acute basically means like a short term. Like once you smoke or take an edible, like what happens, right? So you experience short term memory impairment, especially with words. It's hard to find the right word. You can feel sedation or reduced, which means sort of reduced reaction time, like you're kind of in slow mo, reduced inhibitory control, reduced verbal fluency, and shortened attention span. And so those are kind of what we associate with like someone who just smoked or is high. In terms of chronic use, though, I think that there is less research available on that because there's so many different varieties and strengths of cannabis use. But for those who use chronically, which is daily or near daily use, there are studies that show that it can change your brain, and it changes your brain, especially if you start as a teenager. Any kind of substance or habit that you start as a teen is extremely difficult to kind of break, and there's really important neural development happening as a teenager. And so if you introduce any of these sort of toxic substances or like these drugs, they can alter your brain circuitry, brain chemistry that can have some lasting effects. The structural changes to the hippocampal volume, there's a kind of one study that showed that even 28 years after stopping those changes were present. The hippocampus is a brain structure related, like that consolidates the short-term memory into long-term memory. So I think, if you have some structural changes, like reduced volume, usually means that there's some memory impairment or some issues with the memory. Also, cannabis use, like chronic cannabis use, it can zap motivation, and can lead to like depression, anxiety. And part of that is like it just, whenever there is like like an addiction, any kind of drug, it rewires your brain in the service of the addiction. But at cannabis specifically, it kind of alters functional connectivity in the reward centers of your brain, so that things like the only thing that you may find rewarding is the drug, and probably like not as rewarding as you would have liked it to be. So other things just don't seem as important, or it's hard to get motivated to do anything else outside of that drug use. And with cannabis, that happens very insidiously and kind of slowly, or maybe slowly to the person who's using, while others, maybe parents or loved ones, can notice these changes perhaps a little bit faster.